Let's discuss the symptoms of bipolar disorder, specifically mania. So, I'm not going to be going over the depressive symptoms. As we know, bipolar disorder is diagnosed when a patient has an episode of or major depressive symptoms and either mania or hypomania. Now, diagnosis of bipolar 1 is major depressive disorder plus mania. If you have a manic episode, then it's not going to be bipolar 2 because bipolar 2 has the more calm or the lighter version, aka hypomania, not actually mania. So, what are the symptoms we would expect? So, mania can be caused by acute stress, sudden changes, recreational drug use, and it's also a symptom of bipolar disorder. Now, in bipolar disorder, what are we expecting a patient with mania to be acting like? So, patients with mania, they are expansive. They have high energy. They think that they can take over the world. So if a patient has grand ideas of taking over the world, some sort of grandiosity or superpower, or knowing someone really famous or invisible, again, powers, and they have reduced sleep, so a sleep deficit and high expansive energy, they are likely going through mania. Mania needs to be going on with these elevated mood. Remember, everything's high in mania. So if you think everything's high, you can also remember being high is a cause of mania as well. So substance use. So everything is high, energy is high, they have elevated mood and high energy. The mnemonic we can use is 3 out of 4 of these symptoms include distractibility, impulsivity. So they have high risky behavior, which is why these manic patients need hospitalisation. So we would often hospitalise these patients. Grandiosity, which I mentioned before about those grand thoughts that they will have about themselves. Flight of ideas, they have racing thoughts. Increased activity, decreased need for sleep, and talkative. So when it comes to mania, you can think of all of the things we've mentioned, but it's treated with lithium, which is a mood stabilizer, which has those different side effects, remember. And also, lithium has side effects like Epstein anomaly, which is that cardiac congenital disorder. Lithium can also has a narrow therapeutic index. Lithium is, the mnemonic is lithium, Lithium, L for low, T for thyroid. It can cause hypothyroidism. H for heart, which is the Epstein anomaly. I for insipidus, lithium causes diabetes insipidus. And is for unwanted movement. We can also give valproate, which has the side effects of all pro, which is anemia, liver toxicity, pancreatitis. We can also use atypical antipsychotics like risperidone, and those have side effects like galactorrhea. Now, mania must be hospitalized, and for the diagnosis, we also want to consider functional impairment, aka they're not going into their job workplace. They're not able to function as a functioning person or as in society. Mainly, their job has issues with their current situation.